You'll find that the troubleshooting set is all laid out in a similar manner. Each condition is given a different colour so that it's quick and easy for you to find the conditions. On every card, there is a definition or a goal for the condition. There is also a list of signs and symptoms with a photo, and then there is also a management plan or treatment options listed in every card. Now it is up to you as the user and the health worker to identify what the conditions are and what the most appropriate management plan will be. Remember, every woman has an individual case or individual situation, so you need to use your own clinical judgment to decide what would be the most appropriate management plan for her. Breast engorgement. Now this is usually caused by congestion from increased blood flow, accumulation of milk and edema, which is swelling and fluid retention. The signs and symptoms of engorgement include that it usually sets in around 2 to 5 days postpartum, but it can occur at any time. Usually it will last 12 to 48 hours if treated. Now the breast can appear swollen, full, red, tight and shiny. Mum may have mild to severe pain, which may be throbbing. Increased heat is sometimes seen in both breasts, and mum may appear to have flattened or stretched nipples, making it difficult for baby to latch and can sometimes cause nipple trauma. Mother may also have a mild fever, and severe engorgement may usually indicate insufficient milk removal or overproduction. So you'll see in the photo here that this is a picture of engorged breast with nipple trauma. So the overall goal for managing engorgement is to reduce congestion. This means move the milk from the breast. To do this, you'll want to feed baby frequently, so approximately 1.5 to 2 hourly during the day and 2 to 3 hourly at night. And please be mindful that prolonged engorgement may lead to decreased supply, so finding the cause, if unknown, is important. Usually, engorgement sets in the early days when the milk is coming in. But if the baby is feeding effectively and draining the breast, then mothers should be able to avoid getting engorgement. Lastly, it is important to acknowledge that there are alternative treatments, but the best thing you can do is consult a qualified health practitioner in terms of what's available in your area. Manual lymphatic drainage. Now this involves gentle massage by a trained therapist, and they're massaging the congestion or the extra fluid into the lymphatic system so that this can help clear some of that congestion. Okay, so if a mum does have engorgement, some of the following suggestions can help. So before a feeding, you want to make sure that she avoids using cold compresses immediately before the feed, because we know that this can inhibit letdowns. So we want her to apply warm compresses and massage, as we know that this is what helps a letdown. This is what's going to help the milk flow easier. Okay, but we don't want to do this for long periods, as remember, the warmth will attract more congestion and increase swelling and inflammation. So just a small amount of warm compresses and massage will help. If latching is difficult due to full breasts, she may want to try and do reverse pressure softening, which is going to be shown in the next card around edema. So she may also want to try expressing a little milk to help soften the areola and nipple area. Then during a feed, when she's got baby latched on, and obviously we want the latch to be as effective as possible so that baby can drain the breast effectively. But during the feed, she could try positions like the laid back feeding position to help achieve that deep latch and ensure optimal latching and positioning. Obviously we want to start with the fullest breast first and to feed as long as possible so that the breast is getting drained effectively. So remember to finish the first breast first and then offer the second breast. She can also apply a little bit of breast compressions, which is where she holds her breast tissue and squeezes for 60 seconds and then releases and continues to repeat this. This will help remove any lumps or congested areas. And also massaging out those lumpy areas is going to help. And also, if the other breast is very full, make sure she knows to allow that breast to drain freely. Okay, so after the feeding, things that can help is if baby wasn't able to drain that breast effectively, she may need to express. And remember that this should only be done to pump to comfort, so expressing just enough to relieve the pain. Also, applying cold compressors can help, and evidence has shown that either one is just as effective as the other one. So gel packs, chilled cabbage leaves, bag of frozen veggies, they are all proven to be equally effective. So when using cabbage leaves, just make sure you explain to her how to do this effectively. Make sure she rinses it, takes off any toxins or sprays that may be on the cabbage, and to remove the vein and make some space for the nipple area. Now, just be mindful that some studies do suggest that prolonged periods of cabbage leaves can decrease milk supply. So some studies suggest 20 minutes on and 20 minutes off, and then repeat this several times. She can also consider a non-prescription analgesic, so something like Panadol or ibuprofen, things that she can get over the counter. They can also be effective in reducing pain and swelling. Also, sometimes completely draining the breast, usually with a breast pump, can just help clear that congestion. So I like to liken engorgement to a big massive traffic jam on the highway. And when there's a big traffic jam and there's lots of congestion, cars can't move very easily. They can't get to where they need to be. And it's a bit like the breast. If you can clear the congestion and clear the roads, then those cars can move freely, just like the breast milk. And so this is the overall goal of engorgement. And when I explain it to women like this, they understand what they need to do. Lastly, it is important to acknowledge that there are alternative treatments, but the best thing you can do is consult a qualified health practitioner in terms of what's available in your area. Manual lymphatic drainage. Now this involves gentle massage by a trained therapist, and they're massaging the congestion or the extra fluid into the lymphatic system so that this can help clear some of that congestion. Now we're going to talk about edema in the breast. So edema occurs when fluid from the blood vessels seeps into the breast tissue. The tricky thing about edema is that it can be mistaken for engorgement. They both appear to be very similar, but how you treat and manage the two are very different. So signs and symptoms of edema is that the breast will feel rock hard and full, just like engorgement, but this time there will be no milk flow or very little milk flow. The mother may have had IV fluids in labour or syntocinon, and we know that these can cause edema in the breast and fluid retention in the postpartum period. Her hand and feet may also be swollen. You may notice some pitting in her breast, so you can look for indents from the bra, and you'll see in this photo that just above the areola, the breast is indented. Edema usually appears within 48 to 96 hours after the birth, which is the exact same time as engorgement, which is why the two get mixed up. Latching may also be difficult for the mother as breasts are full and nipples may flatten. Now with the management plan, the overall goal is to shift interstitial fluid towards the lymphatics to relieve pressure in the breast and to allow milk to flow easily. So when I explain this to mothers, I explain it so that they can liken the milk flow to a hose. And if they can imagine a hose with milk flowing out, and that the fluid is pushing and putting pressure on the hose from the outside and blocking the flow of the milk. So if they can massage or shift and move the fluid away from the hose, then the milk can flow out easily. So when they understand it this way, they know what the overall goal is and what they need to do to achieve better milk flow. Okay, so with the management of edema, it is really important to understand not to use the pump, as the pump will only draw more fluid into the areola and cause more congestion and more blockage. So what you want to do is lay the mother flat on her back or leaning back, as this helps allow gravity to aid with the lymphatic drainage. This helps the fluid to go back into the lymphatic system. Then you want to teach her how to use reverse pressure softening. This can be really effective in shifting the fluid that is sitting around the nipple base, and by doing this it will allow the milk to start to flow freely. So to do reverse pressure softening, all she needs to do is apply one of these pictures, have a look and look at what position works well for her. The overall goal is putting gentle backwards pressure towards the nipple base so that the fluid can be shifted away from the ducts and then the milk can flow easily. So massage away from the nipple towards the armpit area can also help. Now with edema, you're going to need to feed the baby immediately, as the fluid will return quickly. One thing I often find really helpful is that immediately after mum has done the reverse pressure softening, then placing baby on top in the laid back position. What this means is that the fluid can continue to flow backwards while the milk can come forward, and baby is able to get a nice deep and effective latch. If baby is unable to feed, then she will need to hand express. The biggest and important thing that she can achieve is to move some of that milk, because by moving the milk it will help clear some of the congestion in her overall breast. After this is all done, apply cool compresses between feeds. So again, gel packs, chilled cabbage leaves, a bag of frozen veggies, they are all proven to be equally effective. When using the cabbage leaves, again, remember to explain to wash these and to cut a hole for the nipple. And be mindful that prolonged use can cause decrease in milk supply. The sore nipples card is a massive topic to cover. There are so many reasons why women get sore nipples. And so what we have done is broken the card into 6 main causes. The way to use this card is to firstly identify the symptoms presented. Once you've identified the symptoms in the top boxes and you've found the right box, then you can follow the arrow downwards to find the most possible cause for those symptoms. Once you've found the cause, it then flows down to a general care box. So these are things that you should consider with any form of nipple pain. This is your general care. Once you've covered that with the woman, you can then move down through the next arrow that flows to the next box and find specific management plans depending on what the cause is. And with sore nipples, if you can find the cause, then you can find the cure. So for example, if you're seeing a woman and she explains that she has deep cracked nipples and it's very painful at breastfeeding, you would then identify this in the top box on the left hand corner. Follow the arrow down and you will find that the most possible cause for this symptom is technique issues. And then you just work your way down to identify whether she has deep damage or superficial damage and what things you should consider when talking about management plan. The other thing to remember with this card is that you may have a mum who presents with several symptoms. So for example, if she has damaged nipples with deep cracks and she also has a baby who is clicking, slipping or clamping, or there's friction pain during the feeds, then you may want to consider whether baby has a tongue tie or if there is some infant anatomy issues. And then you would go to that box and work your way down so that you can also build on your management plan through several other boxes depending on what the symptoms are that are represented. Thrush is also another common breastfeeding condition. What it is a fungal infection caused by an overgrowth of yeast-like organisms called Candida albicans. It spreads easily from person to person. The most common sign and symptom of thrush in the mother is that breastfeeding has been going well, and then there is a sudden onset of pain and discomfort. Other complaints is that breasts will feel painful despite there being a good latch. The mother will often complain of burning, itchy, shooting pains. Nipples may appear normal, but often they are shiny, red, flaky, or have a visible rash. Deep radiating pain within the breast can also indicate that it could be intraductal thrush, which means it's inside the breast. It is rare, but it can occur. The other thing to consider is that there may be a bacterial infection also. What thrush is usually associated with is if the mother has had a course of antibiotics or is on corticosteroids or contraceptive pill. Also, other associations include a mother who has diabetes or is anemic, or a baby who uses pacifiers in bottles. Also, things to consider is if she has thrush in other parts of her body, she's most likely to have it on her nipples as well. Signs and symptoms of the baby include having white patches inside baby's cheek or on the tongue, and you'll see that demonstrated in the picture on the right top hand corner. For baby though, the symptoms don't always have to be visible for baby to have thrush. But most commonly, baby will have these white patches and may be uncomfortable or in pain, making him fussy and unsettled. And sometimes babies will click at the breast or slip off frequently. So hygiene is really important, and it's got listed there some basic ideas of what mum should think about around hygiene. Also, the diet can really affect the prevention of thrush and also treating thrush. So eating a well-balanced diet and drinking enough water is important. Being conscious of the amount of sugar intake can also affect thrush. And being mindful if mother expresses and stores her milk well infected, just remember not to use this milk as it may reinfect the baby at a later date when the thrush has cleared. Now on the other side of the card, on the next card, it breaks down all the alternative treatments and also the medical treatments. Now please remember that the most appropriate medication and dosage will need to be selected at the discretion of the prescriber. So trade names, subsidised products and availability may vary from region to region and country to country. Although further research is needed, the following antifungal agents have been found to be effective. So just some reminders around thrush. Remember, breastfeeding can and should continue. If it's really painful, then the mum should take pain relief. And remember to apply creams after feeds, wash hands before and after, ensure the full course of medication is taken, treat both mother and baby, and consider other household members. And remember, follow up is necessary as some strains can become resistant, and you will also need to follow up to make sure that it's not a bacterial infection. The following 4 breastfeeding conditions are related to each other, which is why they are all on the same coloured card, green. We have milk blebs that can often lead to plugged ducts, and plugged ducts can often lead to mastitis if left untreated. We also know that mastitis can lead to abscesses if it's not resolved. So firstly, milk blebs are solidified milk that blocks the milk pores. Ideally, these can sometimes open on their own during feeding, but if not, you may need to be proactive around the management. So some things to try is you could try soak the nipple in warm water or use a warm water compress or olive oil to help soften the skin. If these measures don't work, the mother may need to seek medical help to gently open or lift the skin with a sterile needle. This should be avoided doing it on her own to prevent infection. If the mother continues to keep getting milk blebs, she may need to consider some of the other things written on this card. She may want to try to decrease her saturated fats in her diet. She may need to use this exfoliant every day in the shower. And she may want to consider alternative treatments such as lecithin supplements. These help thin the milk out and can be purchased from a health store. If she would like to use this, she is best to consult a trained practitioner. Plugged ducts are an area of the breast where the milk flow is obstructed. So the most common symptom of a plugged duct is that the woman will experience painful, swollen, hard lumps in her breast. The woman does not usually experience systemic symptoms, and so plugged ducts do not need antibiotics for treatment. However, if they are left untreated, they can go on to cause mastitis. So it's important that when you are looking at the management of plugged ducts, that you consider the following: heat, massage, rest, and draining the breast. You want to treat a plugged duct immediately and aggressively. If it is left for too long, it will then progress into mastitis. So you definitely do not want to stop feeding the baby. You want to encourage the mum to feed frequently and start on the affected side first. So before she goes to feed baby, you want to encourage her to apply gentle but firm massage and warm compresses to encourage the milk flow. Then, while she has baby latched and she is feeding, you want to feed from the affected side first, remember, and try different positions, as the different positions can put different pressures on different areas of the breast, which may help dislodge the plug. Massage and breast compressions can also really help to move those plugged ducts. After the feeding, you want to either pump or hand express to aid the draining if baby hasn't been able to unclear that blockage. So keep going, don't give up, and keep trying to unplug the block. And you'll see on the card there that there are some other treatments to consider as well. So now we're going to cover mastitis. Now mastitis means inflammation of the breast, and this can be caused by two reasons: non-infective mastitis or infective mastitis. Non-infective mastitis, or milk stasis, is caused when milk backs up and leaks into the surrounding tissue, causing inflammation. This can then lead to infective mastitis. So the common causes of this type of mastitis is engorgement or oversupply of milk, or basically any things that cause milk to not move inside the breast. Infective mastitis is commonly caused by Staphylococcus aureus, which is a pathogen. So the symptoms of this type of mastitis is that there will be a tender or painful area of the breast with any redness or wedge-shaped or lumps. Mum may experience flu-like symptoms, so she might have a fever or chills, or general fatigue. She'll just feel fluey. Baby may refuse the breast milk as it can taste salty, and she may have headaches or a temperature. So the most important message with a woman who has mastitis is do not stop breastfeeding. She will struggle and she'll need extra support on board. So the most important thing to do is investigate the cause. Why did she get mastitis? Is it milk stasis or is it infection? Keep the affected breast as empty as possible and feed more frequently, so at least 2 hourly, or express if necessary. And with mastitis, it's important that you refer to a doctor or midwife for primary assessment or consult with a lactation consultant. So some things that she could try before the feeding is, again, applying heat compresses or gentle massage just before to encourage the milk flow, but not for too long. Loosen any restricted clothing, and then when she does start feeding, feed from the affected side first. If painful, switch to the affected side after she's had the first let down. Make sure that the latching and positioning is as best as it can be, and try different feeding positions. Use massage and breast compressions to remove any lumps, and massage from the blocked area to the nipple. Again, after the feeding, express or pump if baby hasn't been able to drain that breast effectively. Encourage her to take regular pain relief, non-prescription ideally, and apply cold compresses between feedings for the pain and for the inflammation. So if the symptoms are not improving within the first 24 hours, she may need to consider antibiotics. And you will want to consider antibiotics if you can definitely rule out that it is not the non-infective mastitis. So if you definitely feel like it's infective mastitis, if the mastitis is in both breasts, if baby is less than 2 weeks old or been in hospital, because it could be MSRA, so you need to consider that as well. If you've got a nipple that has significant amount of trauma and signs of infection, such as yellow crusting or blood or pus is present, then you may need to consider antibiotic treatment, and also if the symptoms are severe and they come on suddenly. So it's got some of the antibiotic treatments, but please, the most appropriate medication and dosage will need to be selected by the discretion of the prescriber. Trade names, subsidized products, and availability may vary. So this is completely up to the prescriber to decide what treatment would be best. It's also important to consider milk cultures if the mastitis is recurrent, or it's not responding to the treatment within 48 hours, or if it's a really severe case. And again, there are plenty of complementary therapies that can be very effective with treating mastitis. However, these shouldn't replace other treatments recommended, and mothers should consult a trained practitioner when considering these alternative treatments. Of course, the mother is going to need to get lots of rest and ensure good adequate food and fluid intake, and she will need help at home. So remember to consider those in your breastfeeding plan. An abscess is a collection of pus from breast tissue that has been broken down, usually from the pathogen Staphylococcus aureus or occasionally MRSA. If you have a woman that presents with an abscess, you will need to make sure that she is referred to a doctor. If you're involved with her care, you need to make sure that she undergoes the following tests and procedures. So often an ultrasound to diagnose the area and the extent is needed. Once you have an idea of what the abscess is looking like and how large it is and where it is, they may also do blood cultures and swabs to check for infective pathogens. Antibiotic therapy should be based on blood cultures, and gram stain will be required. Often, if the abscess is large or there's lots of abscesses, she may need to go to surgery for drainage. Otherwise, under ultrasound control, they can also use needle aspiration or catheter drainage as an alternative. If she has had a surgical drainage, a drain will be left in place, and covering the drain with a dressing may allow breastfeeding to continue. It will need to be changed regularly though. So some things to consider if she has had an abscess is that the breast actually still needs to be drained, and breastfeeding can and should continue. This actually helps the breast to heal and avoids further congestion and early weaning. She will need a lot of support though. If the surgical site is too close to the areola or the drains interfere with sucking, or if the abscess ruptures into the ducts, the baby may not be able to feed at the breast, and so the mother may need to express instead. If frank pus is present, so if there is a lot of pus present, she may want to or she may need to discard it. The Sleepy Baby card is designed to give some practical ideas and things to consider when baby is too sleepy to feed. Now, it's important to understand what is normal. So, newborns need approximately 6 to 18 effective feeds in 24 hours. And this is to gain adequate weight, maintain milk supply, and avoid jaundice. So, if a newborn sleeps longer than 4 to 5 hours or falls asleep without actively sucking for at least 10 to 15 minutes, you may need to awaken and encourage baby to breastfeed more often. And so the following boxes just help give some tips and also things to consider. So possible causes. It's good to know what the cause is so that you can look at the management plan. Waking techniques. So these give some practical ideas on how mum can help wake baby up. And then there's also how to keep baby interested when at the breast. And we've also got stimulation. So what things can you do to help keep baby stimulated? And of course we want to not overstimulate baby all at once, as this can actually have the reverse effect and cause baby to shut down. So just gentle things like rubbing or patting baby's back, changing baby's nappy or bringing up the wind, massage baby's palms or feet, skin-to-skin contact. These can all help stimulate baby to want to feed. The Red Flags card is designed for health professionals so that they can identify when there is a breastfeeding problem and whether they need to monitor the situation closer or make an appropriate referral. If you take the time to read through all the bullet points listed on this page, you can then think about who you would refer to and when. Low milk supply is another common breastfeeding condition, and there are many reasons why mothers experience low milk supply. The most common causes can be separated into 3 different groups. It will either be management reasons, mother issues, or baby issues. So for example, with management reasons, perhaps there is poor latching technique, or mum is using nipple shields incorrectly. If it's a mother issue, perhaps there are some anatomy issues, like she has underdeveloped breast or has had breast surgery. For the baby issues, perhaps there is abnormal oral anatomy, for example a tongue tie, and that affects the stimulation at the breast, which then affects the milk supply. In order to help a mum increase her milk supply, it is important to come up with a good management plan. And the first thing you want to do in this management plan is investigate the cause. You need to figure out if the low milk supply is from a medical reason or poor breastfeeding management reason. Once you have figured this out, then you can decide on your management plan. It's always really important to make sure that baby has good positioning and has a deep latch at the breast, because we know that effective sucking and adequate swallowing and good stimulation helps the milk supply. You want to make sure that baby is able to feed at night, is having lots of skin to skin, and is feeding frequently, as this all helps the release of oxytocin. When a baby is feeding at the breast and the swallowing slows down, breast compressions can be very effective to help increase the milk flow again. When this all slows down and that breast is drained, she may offer the other side. This is called switch feeding, and you can switch between breasts 2 to 3 times or more during each feed. Milk boosters, also known as galactagogues, have also been shown to be effective. Galactagogues can also be very effective in increasing milk supply. I refer to these as milk boosters. I would suggest the mother consult with a health store or a qualified naturopath first, however. Things like blessed thistle and goat's root are commonly used to increase milk supply, and they are all natural, so they have very few or any side effects. Domperidone is a prescribed drug, and it should never be used as the first approach. The information around the drug should be given to the woman before considering using this drug. Other things to consider around the management is if baby does need top-ups, how and with what. Always start and finish at the breast. Expressing can definitely help increase milk supply. And the most effective way to do this is waiting 1 hour after the feed. Also double pumping or hand expressing combined with pumping is also shown to be effective. So just remember, the more frequently the breast is stimulated, the more the chances of the milk supply increasing. Remember to help the mother check the outputs to ensure that baby is getting enough intake. Consider foods that help increase milk supply, and so we have some listed there for examples. Now, sleep has also been shown to increase prolactin levels, which of course we know is the hormone that helps increase milk supply. Some other things to consider is just educating the mother around different principles so that she can understand what she needs to do to increase her milk supply and why. Now, if there are no improvements after a thorough management plan, consider a full physical examination to rule out any underlying causes. So, for example, if you haven't managed to get any increase in the supply, perhaps it's worth the mum considering if there is some underlying hormonal issues. The slow or poor weight gain card is separated into different sections. So you'll see the first box on the left-hand side identifies possible causes before 6 weeks, and then the box next to it identifies additional causes after 6 weeks. If we look at what the possible causes could be for low or poor weight gains before 6 weeks, it is then broken up into it either being a management problem or a medical issue. The card also identifies red flags, so this is when you should be monitoring very closely or we need to take action. So for a baby 2 weeks to 3 months old is gaining less than 110 to 200 grams per week, may need to be referred to an appropriate health professional. If there is a baby with a lack of weight gain, significant jaundice or unexplained weight loss at any age, this causes a red flag and baby will need to be monitored more closely. In terms of the management of a poor or slow weight gain, we should consider the following things. Definitely refer to an appropriate health professional if you're concerned or if baby is flagging any of those red flags. Try to establish a thorough history around the baby's weight gains, length and head circumference, gestation. Calculate the weight gains from its lowest point. And in New Zealand we use the WHO growth charts. In terms of the breastfeeding, the priorities should be: number 1, feed the baby; number 2, protect the milk supply; and number 3, try to fix the problem. This card is about oversupply and forceful letdowns. On the front side of the card, it identifies what the common signs and symptoms are for both mother and baby. And if you read through these with the mother, she will be able to identify whether this relates to the symptoms she is experiencing. Then you can flick over to the other side, and the other side is separated into 2 sections: managing the supply and managing the feeds. If you work your way through the information and then show the mother the different pictures on ways to latch, and in the right hand bottom corner, this relates to how it is important for a mother with forceful letdowns or oversupply to ensure that her baby is able to drain her breast effectively before she offers the other breast. So this is to ensure or emphasize to her that it's important that baby makes its way through the whole course of the feed, including the entrees, mains and desserts, so that baby can get a good balance between the low-fat milk and the high-fat milk. The last card in the troubleshooting set is flat and inverted nipples. And the key message I wanted to put across on this card is that babies breastfeed, not nipple feed. And so it's important that women with flat or inverted nipples understand this message, and that they understand that although they don't have a nipple, it doesn't mean that they can't breastfeed. It is important to avoid screening mothers during pregnancy for flat or inverted nipples, as studies have actually shown that women are less likely to experience problems when they receive no antenatal treatment for this. So try to focus on good positioning and latch rather than inadequate nipples. So the way you can tell if a woman has truly inverted nipples is by doing the pinch test, and you can see that illustrated in the photo. When a woman pinches her nipple and it becomes erect, it is not flat or inverted. If the nipple retracts inward, it is a true inverted nipple. On the other side, it has two boxes. So the first box on the left-hand side, this box emphasised the importance of good latching. So if possible, allow baby to do the breast crawl, as this will help. Getting a deep latch is important. Shaping the breast is really important, and making sure mum feels confident with holding her breast and all the different latching techniques and positions. In the early days, you want to avoid teats and pacifiers if possible. And if there is only one breast with an inverted or flat nipple, baby may begin to prefer the other side. So try putting baby to the least preferred side first, or well in a light sleep. So what to do if baby can't latch on? If baby can't latch on, then try placing baby on top of mother in the laid-back latching position, as this can help stimulate baby to attach and suckle in the early days. The other thing to consider is hand express or pump to stimulate the milk supply, so we need to make sure we look after the supply while we work out the latching. Once you've expressed this milk, try to give this to baby using a spoon or a cup or syringe in those early days. Some other things or suggestions to try for a mother who has inverted or flat nipples is to soften the breast. You want to make sure the breasts are soft so that it's easier for baby to latch onto. Nipple stimulation can help, by rolling the nipple between the thumb and forefinger, or touching the nipple with cold moist cloth. And then there are techniques of drawing out the nipple, so using a breast pump. In some cases it can help stretch the adhesions with a truly inverted nipple. Commercial devices are available, but these should be used with caution. And be mindful that breastfeeding is not nipple feeding, so try not to focus on the nipples. Nipple shields, they can be effective, but not often used as a first approach. So if the other strategies are not working, then try a nipple shield. And just make sure that it's the right size and technique. So sore nipples may occur in the first couple of weeks as the tissue is stretched and drawn out. This discomfort should be temporary and different from nipple damage caused by incorrect latching. So follow-up may be needed if pain persists for longer.